the doctors at Burnaby Hospital noted that there was inadequate cleaning and said this was part of the reason for the C.difficile outbreak. A constituent of mine, Ujagar Gill, is a 77-year-old patient at Burnaby Hospital who has been in the hospital for 6 months now waiting for residential care. Unfortunately, Mr. Speaker, the care Mr. Gill has received paints a picture of inadequate cleaning. The family has asked repeatedly for the room and the bathroom to be cleaned, only to be told that there is not enough staff. This is just one example of the Liberals failing Burnaby patients, Mr. Speaker. What is the minister doing to ensure the patients have clean hospital rooms in Burnaby Hospital?
Minister.
Thanks, Mr. Speaker. Well, here's a significant difference that characterizes the circumstance today versus what it was not so long ago. The member can stand in the House and present as part of his line of questioning specific data that is tracked on a weekly, monthly, and quarterly basis. He couldn't do that 10 years ago. There was no data. We actually take these matters so seriously that we have measurements in place, the health authorities have measurements in place, and that data is presented publicly so that people can assess the progress. In the case of Burnaby, I will say again, in case the member wasn't listening early, there have been challenges. The people that work there do so diligently and have managed to bring the incidence of infection down by 40%. Not as far as we would like it to be, but they are committed, and all of the people that I met with yesterday, Mr. Speaker, are committed to the objective of reducing the incidence of C. difficile infection and providing a safe environment, continued safe environment for the people in that hospital.
Member has supplemental.
Thank you, Mr. Speaker. The minister can quote all the numbers and data he wants, but the fact remains the patients at Burnaby Hospital are not getting the services that they deserve. Mr. Gill's family is very concerned about the state of cleanliness in his father's room and bathroom. Burnaby Hospital physician Dr. Kirby, in his March 1st letter to the Fraser Health CEO, said there were unacceptable delays in the implementation of enhanced cleaning protocols designed to help combat the spread of C. difficile. Mr. Gill's son says he noticed the same stains, and we have pictures, Mr. Speaker, on the toilets for 4 days. Nothing was clean. 4 days, Mr. Speaker. The family repeatedly asked for the cleaning to take place, but they were told there weren't enough staff to do it. Is this the kind of standard of care patients can expect at Burnaby Hospital, Mr. Speaker?
Minister.
Mr. Speaker, I'm going to refer the member with the greatest of respect to the report that Dr. Gardam prepared, because to this point I have not heard anyone take issue. The 12th finding says this: the Aramark housekeeping staff appear quite dedicated to their tasks and understand the important role they have in patient safety. Given the additional cleaning being recommended, it may be that existing contracts will need to be revisited. Well, it would help if you read the report. You see?
It's only the facts. Small detail.
Continue, Minister.
The existing external auditing of housekeeping activities should continue. So, Mr. Speaker, I'm sorry if the honourable member is offended by the fact that we actually have data that we collect and report upon and make available to the public. But that's the basis of the public confidence that we will ensure British Columbians can have in the safety of the hospitals that are providing services right across the province.